Hello and Namaskar, I am Sanjeev Pandya welcoming you to the another edition of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers USA. It's all about importance of Ayurveda, benefits of Ayurveda in one's life and how Ayurveda can cure and treat almost any disease or sickness that you may have, and how Panchkarma treatment with the right combination of herbs and oils, which is offered at all Santigram Kerala Ayurveda Wellness Centers in the USA, makes a difference. After all, we all want to live happy and healthy lives. So why not try Ayurveda? And for that, I'd like to welcome Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers to our show. Ambika ji, welcome to our show.
Thank you, Sanjeev, again.
Thank you. And सबसे पहले मैं आपको wish करना चाहूँगा Happy Onam.
Oh, thank you. You remember Onam?
Yes, I remember Onam. और हमारे टीवी एशिया के जितने भी दर्शकों हैं, अगर वो ओनम सेलिब्रेट कर रहे हैं, तो हम सब की ओर से आपको ओनम की बहुत बहुत बधाई हो.
In North India, they celebrate 10 days. We also celebrate 10 days.
Very nice.
Yeah.
It's all having fun and getting together with friends and family and everything, right?
Yes.
But if your mind is not into it, meaning, let's say, if you are depressed, if you are upset about something, if you have some kind of panic attack and anxiety, then you really miss out on all this happiness in your life, right?
Oh my God.
So my point is that today, Ambika ji, we actually need your help. We need your help once again in giving us information on anxiety and a panic attack. More and more people are affecting to this anxiety and panic attack.
I tell you, yesterday I got a call from Pennsylvania. Okay. So she was crying on the phone. Can I talk to you? Is it good time to talk to you? I told no problem, because I understood there is some problem. Otherwise normally I don't attend the calls. Then I came out and I was talking to her for like 3-4 minutes. So she told that her 21-year-old son doesn't come out from the room. He doesn't go to college. He doesn't do any other work. If no one is there, he just come to the sitting room. That's all, Otherwise, he is not at all coming out for anything. So I asked, why don't you bring him? No, doctor, because he happened to see the show. Actually, this episode I am dedicating to her.
Wow. Okay,
sincerely
that's nice.
Telling.
Yeah, very nice.
Because she told that because I forced my son to see this. Once I talked about this anxiety.
Okay. Yeah, we have actually.
Yeah, so
a couple of months ago we talked about it.
So she was requesting me, I need, not only she, I have other so many, requests also, so that this child can come to me and I can help him more. So he doesn't like to come out. Okay. See, anxiety, it is manageable. Okay. It is not like a panic attack. Panic attack is very complicated.
Okay.
Means you are driving on the, while you are driving very coolly, but in between you are just losing the balance.
Yes.
Yeah. So the accident comes, because you are lost totally. Totally you are lost. You don't know what you are doing. So you just leave the car over there and you just run away. Like that only. Some people call the police at that time. Some people doesn't have any sense. Not only in driving, even meeting people, fear of everything, fear psychosis actually. So many times, even fear of examination, fear of meeting people, like a little inferiority complex. If they have little appearance is little not that good. But this is not actually, it should be educated to them.
So people who get this kind of panic attacks, are they also patients of anxiety? Do they have anxiety? Does panic attack occur after anxiety?
No, anxiety only leads to depression and panic attacks.
Okay.
Actually, anxiety is, I am also anxious to talk, you are also anxious to ask, you understand?
Yes.
So this is for a good cause.
Right.
But this is like, means there is idiopathic, there is no reason. No reason, no concrete reason why it is happening. Because you want to do, say nowadays, our worries are there, like to do the best in life. And I will be jealousy. He bought another big car, I had to buy another. That is competitive mind, unnecessarily competitive. This actually, even parents are also responsible for this. Because children have so much of anxiety and these panic attacks, because this is actually given by the parents.
Because they have so many challenges to meet.
Not only the big challenge, the small challenges also. You have to be first for everything.
Yes.
Like rat racing, unnecessarily. Like it will create all this anxiety and the child will not be able to do. How many cases are coming to me itself?
So while you're sharing this story with us, that one of our viewers in Philadelphia who watches our show, unfortunately her son right now having anxiety attack, and basically he stays in the room. He doesn't want to come out, doesn't want to talk to anybody. And finally, his mother has decided to try Ayurveda, and that's why she contacted you. Well, first of all, I'd like to tell her, thank you for watching the show, and let's hope that what Dr. Ambika Nair is going to talk about anxiety and panic attack in this show, let's hope it helps you, and it helps also another thousands of viewers of TV Asia.
Absolutely.
All right. So, is there age limit for this anxiety when it starts?
No age limit actually, because some children are, like a 3-year-old.
Really?
Yeah, 3 or 4-year-old. They don't like to do anything. See, some days we people only create all those things. We say to especially in our culture, we will be telling if they take the water and go, if they take the computer, we only say no to them. We have no yes to them.
Correct.
So this itself creates a like a fear psychosis in the children.
Achha.
Yeah.
But even a 3-year-old kid would have this anxiety?
Definitely. They don't go to you just go to some school, because here so many behavioral sessions are going on in the schools and all, like how they do a lot of things over here. Really, I appreciate that.
Is it hereditary, that if somebody has in the family, then
see, some hormonal imbalances actually creates this. Yeah. So because this all comes under, like especially the ladies, the thyroid issues, all these things, because that before the conception itself, they should take care so that this can be avoided.
Anyway, Dr. Nair, we're going to take a short break, and viewers, just hold on to your thoughts, whatever that you have about anxiety and a panic attack. Maybe we'll talk about that in this episode. This is the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. We'll be right back after these messages. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers, USA. Every week we talk about any major disease or sickness and how Ayurveda can really help to cure that. And this week we have picked a topic, anxiety and panic attack. I'm sure that you would know somebody within your immediate close friends and family circle might be affected by this anxiety panic attack, as many people are. And the kids as young as, jaise Ambika ji ne bataya, 3 years old, 5 years old and older than that are also part of this anxiety and the panic attack. So hopefully this information will help you. But before that, Dr. Ambika Nair, what are the symptoms of anxiety and panic attack?
Like you are asking a child to do something, not only child, the teenager, disinterest in the studies, disinterest in the present situations. Has to go to college means they don't like to college. They don't like to go to college.
Achha.
They will make small excuses, like not attending the classes.
Why
sleep.
don't they feel like to do anything? Why don't they want to do something?
No, this is the anxiety.
Okay.
Yeah, but it is, like they cannot express it. They will keep in their mind, but they will not express to anybody in the family.
Okay.
So the parents will, they will, if they observe, that will be very good actually. We should observe. Not only, the child should say, not sleeping, playing on the computer, watching all those things, restricted things. And they will not sleep, and they will be taking long time in the restrooms and all, performing anything. So that, that is slowing down every activity.
So having that fear and having that lack of confidence in whether it's a kid, whether it's a teenager, or whether it's a mid-aged person,
or adult, or an old age, any age.
So having this kind of things or combination of these things, that eventually leads to anxiety or panic attack.
No, this will lead to anxiety. This anxiety leads to depression. Okay, once it starts like this, why my friend is doing very good in his studies, why I cannot do it? So his brain will be different, you understand? So they try hard. Oh my God, his friends are doing, why you people cannot do it? See, like a competitive mentality, this is induced actually.
Correct.
So they try hard and they cannot reach, means they are so anxious and they get into deep depression. From there only this panic attack comes.
All right, so when they get into depression, and let's say they try out allopathy, right? Allopathy they try out, and then obviously they go to see doctor and psychiatrist and whatnot, and then all these antidepressant medicines which are out there, you get hooked onto it. Once you get hooked onto it, it's very, very difficult to control it. I'm telling you, it's very difficult.
We get a lot of clients like that only.
Correct. So how can you change individual's mindset? What can you do to cheer that person up, to instill confidence in that person, and have that person thinks positively?
Yeah, this is what I wanted you to ask me.
Ji.
Okay, see, when the person comes in, because I don't talk in front of the parents at that time.
Okay.
If it is a child.
Correct.
Or any individual. So I see the pulse, I diagnose them. Then I ask them, I get into their life like that. So, they will be talking. Told you are very good, you can do better in your life. So that counseling is excellent.
Okay.
Because I induce life in them.
Correct.
See, counseling means they gain confidence in me. Got it? So they will find that, oh my God, okay, I was looking, because they take a lot of trace elements, all those, countertop medications for sleep, for the depressions. So many years they go like this, then only they go to the psychiatrist also. So, they are, instead of improving it, so many people, they drain out their brain.
Correct.
Okay. So while talking to them, their confidence is gained, and we tell them, okay, start like this, take this medications, do this, this will help you. I explain them.
Correct.
What this Panchakarma therapy is going to help you. See, you should have done better, you will do better, like that, we instigate life in them, I'm telling you. It's very easy. And some people are I have like a few cases also like this going on now. You don't know, doctor, what we are undergoing. I always tell them, I understand you, because whatever we say, very interesting. One guy doesn't have hair. So yesterday I was seeing him in the clinic. So he was telling me, you don't understand because you have hair, so I don't have hair. I told him, why don't you try for a wig? Okay. So his confidence. So that is his, problem to face the people.
Correct.
You understand, no? So that itself is, so whenever he goes he is jobless now, out of work. He's a very good family and highly educated. So I'm telling, individualized. So I was telling him, hair is not the issue, your brain is so sharp. So, I feel maybe this is the inferiority complex, what he is facing.
Correct.
So advised him for that.
There are people out there, and there are many individuals out there who are very stubborn, right? So even if you try to counsel them, if you try to explain to them and try to, make them understand that there is a brighter side of the life and there is something called positivity that one should accept in the life, right? But they won't accept it because, they're, let's say, pessimistic, very pessimistic.
They are.
And for them, what they believe is that your problem is your problem, but my problem is completely different story.
This is a very good question, because actually, first of all, they will never come to the doctor.
Yes.
And 90% of the cases, their parents bring to me, parents or, the husband or wife or anything, They will come to me by telling that we are going to a friend. Some days I don't even sit in the clinic. Some days I have to sit outside.
Oh my God.
Yeah, because we are friends. Okay, we just go. So while talking, like, oh my God, you are doing very well. See, the approach is in a very different approach. Okay, then only, very stubborn. Some days, without his knowledge, we have to give the medication. This all depends upon the, their friends or their parents. Okay, so we advise them like that. You can then after 1 or 2 counseling, 1 or 2 times talking, some people doesn't listen, but
there are going to be always some patients who are going to be very, very tough.
Very few. They are very stubborn. Stubborn means, in Ayurveda, what we call is that their Pitta and Vata is on the higher degrees. So that's why they, whatever it is, they will not move.
All right.
Very stubborn.
Okay, now hold on to that thought, and we're going to talk more on this anxiety and panic attack right after the break. You are watching the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. We'll be right back after these messages. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers, USA. Now, those of you who don't know about Santigram Kerala Ayurveda Wellness Centers, USA, let me tell you, that is USA's premier Ayurveda and holistic center, because they provide true, authentic Kerala Ayurveda treatment with right amount of herbs and oils. Herbs and oils are very, very important ingredients, elements for Panchkarma treatment. And as you know, Panchkarma treatment is the most important part of Ayurveda treatment. So Santigram Kerala Ayurveda Wellness Center, USA is the one and the most popular providing authentic and true original Kerala Ayurveda treatments. If you have any Ayurveda related question, health related question, and how Ayurveda can cure your disease or sickness, you can send us an email, info@santigramusa.com. You will see that email ID on the screen as well, info@santigramusa.com. In today's episode, we are talking about anxiety and panic attack and what happens and what not. And we discussed that with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center, USA. Ambika ji, let's talk about possible cure or treatment.
What we do in Ayurveda, if the person is willing, okay, then 90% people are willing for that. Correct. Because they want to go back to their life in a better way. So we do the, Panchakarma treatments are there. Okay, so that is with Nasyam, Talam. Nasyam is a nasal therapy. See, entry to the head is through the nose only. So, we will be doing the detoxification of the upper respiratory system. That is with the brain.
That is exactly, that is the most important thing.
So all the toxins will be removed, See, why this all happens, mentally and physically one has to be stable. At least 85%, right? Then only we will be able to survive in this world. So after this, that we will be putting, especially special medicines are there to apply on the brakma. So this pacify a lot. So once the detoxification is done, we do the Shamana Kriya. Shamana Kriya is done with the Shirodhara. And we do the Abhyangam also, because the Tan Man, body and the mind has to be taken care. Correct. So we do that also. And certain people, because I told you the Vata will be on the higher side, we give them even Snehapanams are there, medicated ghee preparations are given to them. So according to the case we treat. If it is a Kapha disorder means, then we have to induce Vamana for them, and other Panchakarma treatments will be method to them.
So as you give this treatment to a patient out there who's got this anxiety and maybe mild depression or moderate depression, right? Slowly by slowly, this treatment helps that person to think positive, to be better.
Really, after 2-3 days, they will tell that. I thought I will not be able to come out in life, after a few days they will tell that.
Okay. So we talked about causes of anxiety, we talked about symptoms of anxiety, and we talked about possible cure in Ayurveda, which is offered by Santigram Kerala Ayurveda Wellness Center when it comes to anxiety. What are the soft tips that you can share with our viewers?
See, we can do yoga, we can do meditation, but when you are depressed under these things, you will never.
That's what I was going to say.
They will not even get up.
Depressed person does not feel like to do anything.
Yeah.
I have seen some depressed individuals who either eat a lot or who don't eat at all.
Absolutely right.
Yeah, because it's their mindset. They just don't feel like to do anything, and to cure them, it's a big challenge.
So we tell them, like when we take up, like when you get up in the morning, whether you, me, or anybody, you just say that I am perfectly fine to start my day. And it is a big challenge for me to take care of these cases.
Correct.
I tell them, I give some special medications. I'll tell them to take in the early morning 6 a.m. These people will never get up at 6 a.m. So I know 2-3 days they may not take. Parents will go and call, or somebody, then some people will not take it for so many days. By force it will happen. After like a few days they will be ready for that.
Achha.
Yeah.
In the span of a month, Doc, at Santigram Kerala Ayurveda Wellness Center USA, how many patients you see with this anxiety problem?
This anxiety, I should say that around 40%.
All right. Now, let's say when someone comes in and has anxiety attack and finally the person follows the treatment, right? Treatment usually lasts how long?
Like
2,
3
months,
weeks or maximum 4 weeks.
Okay. And then do they have to come back also only when they feel...
No, they will be on the herbs and they will come for the follow-ups and they will be seeing me also in between. So any tips, we taper off all the medications. Not only that, they go to their doctor, they will see that their own psychiatrist will tell that you can taper these medications. That is the beauty of the therapy.
Really?
Yeah.
All right. Well, viewers, we certainly hope that this information on anxiety and how it can be cured, that information, we certainly hope that helped you in this week's episode of Ayurveda Mantra by Santigram Kerala Ayurveda Wellness Center USA. Before we sign off, I just want to say one thing. I just want to let our viewers know, and especially the ones who are watching this show in the New Jersey area, is that Santigram Kerala Ayurveda Wellness Center's locations here in New Jersey, USA, couple of locations. I believe there are 4 locations in New Jersey, right, doctor?
Yeah.
They accept insurance now. So once you bring in your insurance ID card and then your own ID card, and once it's all verified,
relevant papers.
Then all the necessary papers, insurance claim can be processed, or insurance can be offered, so that they actually accept this insurance card. So when you visit Santigram Kerala Ayurveda Wellness Center, make sure that you try it on this insurance matter. And if insurance was the thing that was holding you up till now, that not to visit Santigram Kerala Ayurveda Wellness Center, then my strong recommendation is that you must do that. You must visit it. It's very obvious that our mindset is such that Ayurveda, insurance doesn't cover Ayurveda, but such is not case at Santigram Kerala Ayurveda Wellness Center, especially in New Jersey. For the other states, they are trying, and hopefully they will come up with it. With that note, Dr. Nair, thank you so very much for that information.
Sanjeev, like they were not thinking like that. They used to think that Ayurveda cannot cure all these things. Now they understood that Ayurveda can cure.
Correct.
And one tip I wanted to tell everybody, Ashwagandha, you can always use it. It's for the tan man ke liye bahut acha hai. You should always use Ashwagandha if at all anybody in your family is suffering with this. Okay, and see that they don't eat unnecessarily and excessive food. All this fast food, you should curtail it, at least, which will make you healthy and smile always.
Exactly.
Yeah.
Thank you so much. That's a very interesting tip. And with that note, I am Sanjeev Pandya signing off. Next week, we'll bring another interesting topic in our Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center USA. And remember to send in your email info@santigramusa.com. Any question you have about your health, someone else's health, and then you want to know more that how it can be treated through Ayurveda, then you got the place, Santigram Kerala Ayurveda Wellness Center USA. With that note, we wish you happy and healthy week ahead, and thank you so much for watching the Ayurveda Mantra show on TV Asia. Dr. Mika Nair, you also take care.
Thank you so much.